You're laughing at me. Okay, let's go. Okay, this part of the check-off, I'm going to demonstrate how to do the check-off with both of your hands are sterile gloved, and you have a helper to pour the solution for you. Let me get my biohazard bag. So at this point, we've taken the dressing off, and it's in the bag. Okay, so the dressing's off. We've assessed the old dressing, and we've disposed of it in the biohazard bag. Of course, we had our clean gloves on. So I'm going to go ahead and talk about this, the wound again. The edges well approximated. Yes, they are. They're close together. Signs of infection, I do not see excessive redness. There is redness along the incision line, which is normal. There's no excessive edema. There's no, I don't see any excessive redness and a reason to check for warmth. But if I did, I would put on sterile gloves and palpate the area. He said on a scale of 0 to 10, he had a pain of about 2 to 3, and he was medicated about 30 minutes prior to the dressing change. Loss of function, again, loss of function is usually with an extremity or appendage. It's hard to determine loss of function for the abdomen. Purulent drainage, I do not see any purulent drainage. All we saw was sanguineous, moderate amount of sanguineous drainage on the old dressing, and there's no foul odor. Okay, no evidence of a hemorrhage or hematoma. There's no active bleeding as hemorrhage. Vital signs were within normal limits. The blood pressure was not too low. The pulse rate was not too high. He was not cool or clammy when we walked into the room and assessed those things. Hematoma, there's no hematoma visible at all. That would be bleeding under the skin. There's no drainage like we said before. Measure the wound correctly. Okay. Gloves. I'm going to go ahead and measure the wound. In centimeters, okay, it's about 12.5 centimeters. This is a vertical wound measuring 12.5 centimeters. That's all I need to put. There's no width or depth because it's a primary intention wound. Count the sutures. We have 13 sutures in place. Right. Dispose of my gloves properly. Take them off. Use my hand sanitizer. Okay. I'm going to open up my sterile gloves. This is not biohazard material. I'm just going to put it right in the garbage can. Okay, so I'm going to go ahead and open. Notice again, I'm not going this way, I'm going this way. You will have to recheck if you reach over your sterile field. This might be better. I'm going to turn this over. I want to say also, you don't want to open this up this way because it will go over your dressing. So turn this gloving package away to where it does not flip over onto your dressing. Okay. Step back and up. Okay. This glove is on. Okay. Now I'm going to use my fingers, and I'll use my thumb to help get my fingers underneath the cuff. Then I must pick the thumb up and do not put the thumb down. The thumb must stay up the entire time as I put my second glove on. Pick it up. fix it, sterile to sterile. Okay, keep my hands up and away from my body. Try to do not get it close, keep it away and up from your body. All right, so I'm gonna get my gauze, I'm gonna get my helper to come. All right, if you don't mind, please get that saline, put your hand over the label and unscrew the top, and do not touch the inside of the, okay, these stick together, sterile to sterile. I can hold it down to get that off. Okay, if you don't mind, we're going to go over to the bag, and I'm going to just let you pour a little bit of that out to clean the lip, okay, and then just clean it over and make sure that the top of the bottle does not get onto the close to the gauze. I don't want to contaminate my gauze. Okay, one swipe down. Okay, if you don't mind, just do that again. Thank you. Squeeze out the excess down. Okay, this hand's contaminated. I'll drop it now below my waist, and I'll go ahead and put these next two pieces down. Dispose of these properly. Hold this glove in this hand. If it falls out, then we'll take care of it in just a minute. I'll put clean gloves on and put that in the bag and dispose of the bag properly. So now I'm going to go ahead and tape like before. Date, time, my initials. Loom there. Okay. Case I had to put that back in there, so I want to use my gloves to put that back in the bag. Okay, put that in a biohazard bag. This is a biohazard container. I would take these gloves and put them also in the biohazard container as well. Okay, side rail up. Side rail was already up on this side. Side rail up on this side. Call light. Make sure they're comfortable. If they need anything. And that would conclude your, then you would go chart. And you please use the charting examples that I gave you today to do your charting.